Good afternoon. I am so glad you're with me today. Thank you so very much. I want to talk about some assessment instruments that we're going to be lecturing on and that are related to your 200-point assessment. You're going to just thoroughly enjoy that paper. It's a paper that you're going to look at writing a response related to an assessment of one of two clients. You get to choose either between Sam or Michael. You get to choose whichever one you want, and then we're going to go through a couple assessment instruments real quick here today. The first assessment instrument is for substance abuse assessment. It's called the CAGE. Go ahead and say CAGE. CAGE, good. CAGE is an acronym. The C stands for cut back. Have you ever attempted to cut back on your alcohol? Have you ever attempted to cut back on your cannabis? And then let them talk about it. So it's just a question. And the first risk factor is cut back. Have they ever attempted to cut back on whatever substance choice or behavior choice that they've ever had? The second factor is annoyed. And have you ever been annoyed by someone who criticized your drinking or drugging? So this isn't about the client annoying other people. It's about other people annoying the client because of their substance use. Have you ever been around somebody who's drunk? Oftentimes they're very talkative, very loud, very belligerent. And so what happens here is on the CAGE, the second factor is annoyed. Have you ever been annoyed by someone who criticized your drinking? I remember being at a Michigan State football game and people around me were using substances and they were so high and they were just screaming at each other and standing up and getting sick all over the place. It was hard to watch the football game when they were having such dynamic activity, and I became angry with them. I was very annoyed at them. So what we're looking at here is cut back, annoyed. Have you ever been annoyed by someone who criticized your drinking? The G stands for guilt. Do you ever feel guilty because of your substance use? So what you find is people who are referred from Child Protective Services or maybe who got into domestic violence. Oftentimes, substance abuse, alcohol use disorder will occur prior to domestic violence. Do you ever feel guilty about beating up on your spouse? Do you ever feel guilty about hitting your kids? So guilty is the third risk factor. And the fourth risk factor is eye opener. Have you ever, it's kind of like the hair of the dog. You get up in the morning after a night of drinking and maybe you start off with a couple beers, or especially with cocaine or methamphetamine, and they might start their day off by taking and putting cocaine or methamphetamine by their finger in their mouth over their teeth. So it's kind of like getting an eye opener. So what are the four risk factors for the CAGE? Number one, cut back, annoyed others, guilty, or eye opener. Those are the four risk factors. If anybody has more than two risk factors, there's a high probability that they are substance using. So the CAGE is an easy acronym assessment. It actually works best with older white males, but any score of 2 or above, that's an indicator there that they've probably got a substance use disorder. I really like the Sassi, which is the Substance Abuse Subtle Screening Inventory. Go ahead, say it with me. Sassi, Substance Abuse Subtle Screening Inventory. That is like the gold star of substance abuse assessment. So on the Sassi 4, which is the one we're in, it's for 18-year-olds and above, and administration time is about 15 minutes. There are basically 10 clinical factors on the Sassi. Now, before we jump to the clinical factors on the Sassi, let me talk to you about the first thing that I usually do when I use an assessment instrument is I find out, was the person's response valid? So I'm going to look at what is called the RAP scale on the Sassi, the RAP scale. The RAP scale is basically random answering pattern. So unlike the old MMPI, which had an LFK scale that you looked at, so if people were lying, the LF was faking good, the K, anyway, the Sassi doesn't look at people who are trying to make themselves look more favorable. But what it does look at is, was this answering pattern that they used in responding to the questions, was it random? Did it make sense? And here, this validity scale is trying to detect whether or not the person answered carelessly, whether they responded randomly, maybe they misunderstood the questions, or maybe they weren't paying attention to the test. So the RAP helps determine whether the overall screening results are reliable and valid. So the RAP looks at inconsistent responses, improbable answer combinations, and patterns that statistically don't match and don't sit together. High RAP scores, in other words, scores that are real high on the RAP score, are saying the client had inconsistent responses. He, she, or they weren't responding. It's kind of like they were just marking the responses, but they weren't really thinking about them. Maybe they were confused. Maybe they had reading difficulties. Maybe English wasn't their first language. Maybe they were fatigued. Have you ever been fatigued while you take a test? Possibly they were intoxicated while they took the test. Or maybe that was just defensiveness on their part. So they didn't want to tell us what was going on. So high RAP scores are saying something. High RAP scores, which are a score of 2 or more, high RAP scores are a score of 2 or more. It's basically saying that the test is invalid or unreliable. Therefore, we can't use the responses on the RAP. And any interpretation should be done very cautiously. Typically, when the RAP is elevated, clinicians review administrative conditions to find out if there was something wrong, ask whether the client understood the questions, and consider re-administration. And one of the things that I do with the RAP scale is I go through the RAP scale and see if they had any omissions where they didn't respond to questions. And then what are the questions that they're not responding to? Say they have 3 questions they didn't respond to. Are those all related to cannabis, or are they all related to methamphetamine, or maybe they're related to depression and anxiety? So that's what we're going to look at. So that would be helpful as you think about the RAP. So if scales of 2 or greater are saying that the scale is unreliable, that they weren't consistent when they used when they were scoring. So that tells you something. And when you look at these scales, I'm going to tell you about them individually right now. But what you're going to want to do is you're going to want to, when you talk about them on that 200 question or 200 point assessment and intervention, you're going to want to wrap those scales together. So you can take the cage and use that as an instrument. Then you can take and use the Sassi 4. You can also look at blood alcohol levels. So if you have blood alcohol levels of somebody who was intoxicated, maybe for a DUI, or maybe they had multiple DUIs. Multiple DUIs are saying that a person is using some kind of substance. So if you have multiple DUIs, the Sassi, so from all that information you've got, you look up the DSM-5-TR diagnosis, and you look for the criterion related to substance use disorder. And it's going to list certain things that this client is going to have to say he, she, or they have or experienced. And that's really your clinical judgment then becomes the DSM-5-TR diagnosis that you're looking at. And you're saying, based on all this data I have, and based on, I'm augmenting the cage and I'm augmenting my diagnosis with the Sassi. These are the Sassi's findings. These are the findings from the cage, and I use that to augment my diagnosis. So let's talk a little bit about, my camera just took a swing. So sorry about that. Hopefully we can stay in here. There we go. We're going to try that again. I'm fast on my feet. I can't believe I caught that. So anyway, I'm just going to move that over here. I'm going to hold it for a second. My apologies for that. So when you're looking at it, what you want to do is you want to look at the different risk factors and look at the different scales on the Sassi. 2 of the scales that I find very helpful are the face valid alcohol scale and the face valid other drug scale, the face valid alcohol and face valid other drug. The face valid alcohol scale, the client will go ahead and talk about the types of alcohol that they're using. So what happens there is they're looking at, okay, they're listing the types of alcohol that they're using. So we want to know all the types of alcohol that they're using. Are they using wine, 151, whiskey? What are they drinking? Are they drinking bombers? Are they drinking beer at night? What are they drinking? So face valid alcohol, the face valid alcohol scale, basically they're listing all the different kinds of alcohol that they could be using. The face valid other drug is everything else. So alcohol shows up in the face valid alcohol scale. Face valid other drug would be cannabis, methamphetamines, heroin, things like that. That gives us a full picture of the types of drugs that are used. Now think about this for a minute. If a person scores very high on face valid alcohol, if their score is very high in the face valid alcohol scale, so that would be somebody who basically is saying probably scores of maybe 24 and above. They're saying that they use a lot of alcohol. They're saying that they use a lot of alcohol most days. So that's telling us that the person likes alcohol and that their substance of choice is alcohol. What happens if face valid alcohol is low? It's a low score, say 2. It's saying that they're not doing a lot of drinking, or they're not telling us this truth. But what I would look at is if they're coming in for treatment and on face valid alcohol, their score is low, that would suggest to me that they're probably not using a lot of alcohol. However, if that's the case, there's a high probability that they will score high on face valid other drug. So if they're coming in because they're court mandated because of multiple DUIs, and their score for face valid alcohol scale is very high, their score on the face valid other drug is very low, that's suggesting that they're using a lot of alcohol. If the face valid other drug is high, face valid alcohol is low, that's saying that they're using other kind of substances, and their substance of choices, cannabis or cocaine. There are also people who they don't give a rat's tail what substance they're using as long as they have a substance. So they will have high face valid alcohol and face valid other drug scores. They're just saying they'll use whatever they can get their hands on. So those two scales, face valid alcohol, high score on face valid alcohol means what? They're drinking a lot of different alcohol substances. Their substance of choice is alcohol. If that is a low score and their face valid other drug is high, it's suggesting that that other drugs are their primary substance of choice. Cocaine, cannabis, or if both face valid alcohol and face valid other drug are high, it's suggesting they don't give a rat's tail about what they're eating or drinking. They're just going to go ahead and use whatever they can get their hands on. Now, the next clinical scale is called the symptom scale, SYM, symptom scale. And these items on the symptom scale directly related to substance misuse. High scores at the 85th percentile and above, the client is acknowledging a pattern and history of serious substance use disorder. They're saying, yeah, I've got these symptoms. The next clinical scale is called the obvious attribute scale, or the OAT scale, obvious attribute or OAT scale. OAT scores suggest the client is able to relate to and identify with substance abusing people. In other words, they relate to people who are substance abusing. Their personality type, their behaviors, how they interact with people are very similar to those who use substances. For example, there's a high probability that they lack patience. High probability they have a low tolerance for frustration. High probability that they would have resentment, self-pity, grandiosity. These are all factors of the obvious attribute scale, the OAT scale. So a high OAT scale score suggests clients can relate to and identify with people who are substance abusing. So think about this for a minute. If somebody had a high symptom scale, in other words, these items relate directly to what substance abusing behaviors, and they have a high OAT scale, it's saying not only are they using a lot of substances, they're saying that they're using a lot of substances, but their personality type is very close to matching the very personality type of people who are substance abusing and who fulfill substance use disorder. The next clinical scale is called the SAT scale, or the subtle attribute scale. High SAT scores, these people tend to detach from feelings and they have very little insight into what causes their problems. So in other words, folks who have a high SAT score, what it's saying is they detach from their feelings and they often deny that the situations that they have are brought about by their substance use. In other words, we understand that when they get a DUI, they go to jail, but they're saying, I don't know how the cops know I was substance abusing. They don't see it as being substance abuse. Or they don't get out that they get in fights with their spouse, or they get terminated from employment because they were under the influence at the time of these things. So somebody who has a high SAT scale and a low OAT score may deny the need for treatment. There's also a defensiveness scale, and that's just saying how defensive they are. High scores on the defensiveness scale may be associated with somebody who's just not going to hear out what you want to say, and they're probably not going to be open to counseling. So those are some of the scales we look at. And as you look at the Sassi for Sam and for Michael, you're going to want to take a close look and see, do they understand? Are they answering in a way that is suggesting that they are using a lot of substances? Are they answering in a way that they're denying any substance use behaviors? So if they've got a high face valid alcohol or face valid other drug, they're not denying that they're using. They're saying, I use. If on the symptom scale, they're talking about they're endorsing a lot of symptoms that they have related to, that really match with how people who are substance and active substance use and who fulfill substance use disorder, if they endorse a lot of these items that are similar to those persons who have substance use disorder, there's a high probability that they're going to have substance use disorder. And on the obvious attribute scale, or on the subtle attribute scale, on the obvious attributes, they can relate to people who are substance abusing. On the subtle attribute scale, they have a personality that matches people who drink and drug. So when you look at these factors, when you look at how you want to combine these findings for both, Michael and Sam, you want to have a good idea of what's going on there. I hope this has been helpful. I'm trying to find the actual assignment that you're going to be utilizing. Let me go back and see if I can find that real quick. Don't leave me. You're very important to me. I want you to be here. This is really important. So under assignments, you will find a 20-point assessment and intervention paper. So here, you're going to choose either Michael or Sam. You've got a case conceptualization. I don't want you to use talk about confidentiality. If I perceive you're a danger to self or others, use that for another class. They can go ahead and talk about that. But basically talk about the biological, psychological, and social factors. Create a DSM-5 TR diagnosis. Look at your DSM-5. Look at the criteria. And if they're going to be fulfilling that criteria, then identify what those criteria are. Related to, both of them have suicidal ideation. You'll use two instruments related to that. One is path warm, and we're going to talk about that later on in the course. So you're looking at these 10 risk factors, IS, PATH, path warm, WAR, is 10 risk factors. You're going to look and get a score from those 10 risk factors. Do they have these risk factors present? You're also going to look at the Columbia Suicide Severity Rating Scale, which is a very structured scale. And you're going to identify risk factors that you're going to say that either Michael or Sam have. You want to talk about protective factors. What would be protective factors? Significant others who love them and who are with them. You create a safety plan or approach. You'll want to include a multicultural intervention that will address the needs of LGBTQ plus considerations and discrimination that occurs within that population, barriers to treatment among the LGBTQ plus clients, self-awareness of your own biasness, and then related to the Sassi, utilize those scales, that RAP score. So did they answer with a score of 2 or less, which would suggest that they answered cognitively and lucidly, or were their scores high? That would be 3 and above. If their scores are high, then you can't use what you found out from the Sassi. The Sassi is basically invalid, so you can't use any information. So you're going to want to have a score that's probably around a 2, and I think I gave you that in the information. You have a face valid alcohol score of 28. Is that a high score or a low score? You can take a look at the profile sheet in the material related to the Sassi, and that'll give you an idea if that's a high score or low score. They have a low score on the face valid other drug. What does that suggest to you? The symptom score is a score of 11. What does that suggest to you? An OAT score is of 9. What does that suggest of you? And a SAT score of 10 indicates something. What does that indicate? So look at all these scores and all the data that's been given to you related to either Sam or Michael, and then use your DSM-5 to identify a diagnosis based on the Sassi, the CAGE, and the information that's been provided to you. Then create a treatment plan. Look at what you're doing. I want you to use motivational interviewing. I've got a PowerPoint on motivational interviewing, so you can use that. Talk about how you do that. And also, both clients will be court mandated. So strategies to reduce resistance and increase engagement in counseling using motivational interviewing. How do you maintain therapeutic alliance and address the external pressures that maybe they might be going through? One of the things that you watched a video on is, if it's a court-mandated client, don't take their word for it as to what their treatment plan ought to be. You want to talk to the probation officer or the CPS worker, the Child Protective Service worker, and find out, okay, they're being mandated into counseling. What are the goals that you want them to achieve? So those should be the treatment goals that you have based on either your discussion with the judge or the client's probation officer, or if it was related to Child Protective Services, whatever the case manager is saying that the person should be working on in therapy. So what can you do? You've got ethical and legal considerations, your duty to protect, your risk management. What are you going to do? Confidentiality, informed consent. I've got a list of things that you're going to want to address for this very interesting assessment and intervention plan. I hope you have a blast with it. Make it a lot of fun for yourself. This is an easy way to learn how to both assess, create a treatment plan, and use these assessment instruments. So use them well, learn much. You're going to be doing this for the rest of your life. So have fun with it. If you need to get a hold of me, I'm at gerald.junkie@utsa.edu. You have a great afternoon. Take care now. Bye-bye.